Hello everyone, welcome back. Let me ask you something. Have you ever heard of someone who dies suddenly after eating a certain food, taking an injection, or using a drug? Sadly, it happens, and often the cause is something called anaphylaxis, a common condition many people in Nigeria know little about. Today, we are going to change that narrative. What is anaphylaxis? Anaphylaxis is a severe and life-threatening allergic reaction. It's a form of severe allergic reaction. It happens suddenly, often within minutes to a few hours after contact with an allergen. This condition affects multiple parts of the body, including skin, lungs, heart and blood vessel, stomach and intestine, and it is a medical emergency. Every second counts. Every second counts. So how does anaphylaxis happen? Here is a simple breakdown. When a person gets exposed to something that they are allergic to, example, it could be peanuts or it could be medication. Because of that, their immune system overreacts to that allergen that they are to that something that they are allergic to. And the most important immune cell in this process is what we call mast cell, which we can see up here. And this mast cell is going to go crazy and it's going to release a lot of chemical into the blood vessel. And this chemical is what we call histamine. This particular chemical that is called histamine, it causes the blood vessel to become very leaky. So they become, and that will lead to low blood pressure. It causes the airway to become swollen. And then patients start having trouble breathing. And it could cause the skin to flare. So they could start having rashes and a redness of their skin. So what are the common triggers in Nigeria? You will be surprised how common these triggers are. One, foods, example like things like groundnuts, peanuts, shellfish, eggs, milk. Medications is also a big one, particularly penicillin. Anti-inflammatories like ibuprofen that we take most of the time for pain. Insect bites, latex, which can be found in gloves and some certain condom. And of course, I've heard people died while having sex, and some of those have been blamed on magnum, which is also called thunderbolts in Nigeria. Lastly, it could be exercise induced, or sometimes we don't know the trigger, which is what we call idiopathic. So when we don't know what's causing a particular disease, we call it idiopathic. So what does anaphylaxis look like? So the things that we look for. So in the skin, we can see itching skin, bumps on the skin. They could have swelling of their lips, their tongue, their face. They could have very red skin, which is what we call flush skin. In terms of their breathing or respiratory, they could be having shortness of breath, tightness of their throat. They will not be able to speak, so they could have hoarseness of voice. In terms of their cardiovascular, which is what we call the heart and the blood vessel, their heart rate could be beating really fast. They could be having dizziness. They could have low blood pressure, and they could have fainting feeling. In terms of their stomach, which is what we call gastrointestinal, so their stomach and their guts, they could be having nausea. They could be vomiting. They could be having diarrhea, a lot of cramps in the abdomen, in their belly. In terms of neurological, which is what we call the mind and the feelings, they could become very confused. They could be anxious, and they could have what we call they will be having feeling that something bad is about to happen, which is what we call sense of doom. So how is this diagnosed? How do we diagnose this as a clinician or as somebody that's seen this? How will you be able to recognize this? Unfortunately, there's no blood test that tells us instantly that somebody is experiencing anaphylaxis reaction. It is mostly clinical diagnosis, so you have to be familiar with the signs and symptoms. So the diagnosis is based on one, sudden symptoms. So in other words, the symptoms started suddenly. Two, involvement of skin, plus either breathing difficulty or low blood pressure. And of course, it's important to rule out other things that could mimic anaphylaxis. For instance, like asthma attack, panic attack, or fainting, which is what we call syncope. So how do we treat this condition and how do we respond? Emergency response. Number one, the life-saving medication here is epinephrine. Epinephrine is the life-saving medication, and it must be injected immediately into the thigh of the patient, which is what we call auto-injector or hospital administer. And then secondly, it's important to support their breathing. You want to make sure you keep their airway open. You want to give them oxygen if it's available. And then lastly, call for help. Get them to the hospital as soon as possible. Get emergency medical services involved immediately. And how can this be prevented? How can we prevent it? Prevention is better than emergency treatments. So you want to make sure you avoid any known allergen. So if you've been told before in the past that you react to penicillin, you want to stay away from penicillin. Also, most importantly, you want to read the food and drug labels carefully, making sure anything is not there that you're allergic to. You want to wear medical identification if you've been told in the past that you've had anaphylaxis, so that people will be able to recognize it as soon as possible. Like we mentioned earlier, every second counts. We want to educate family, friends, and schools to be aware of this in case they can quickly recognize it. And of course, always carry epinephrine auto-injector if you're at risk. Though it's expensive and rare in Nigeria, it can be a life-saving. So what are the take-away messages from this video? So take-away points from this video. One, anaphylaxis is a medical emergency. Secondly, avoid allergens if you know them. Third, epinephrine is the first and the most important treatment. Number fifth point, people at risk should always carry their medication. And then lastly, learn the science and educate others around you. Thank you again for visiting this channel. Let's stay aware, prepared, and ready to save lives. Thanks for watching. If you found this video very helpful, give it a thumbs up and subscribe for more clear videos. If you have any questions, drop them in the comment section. Don't forget to like, subscribe, and share this video with someone. Thank you, and stay connected to Nigeria no matter where you are. Bye, take care, and I will see you in the next video.